We can speak now to Dr. Margaret Harris, a spokesperson for the World Health Organization in Geneva. Thank you very much, Dr. Harris, for joining us again. Really good to see you today. Now, the WHO has said that patients being treated in Gaza hospitals are facing what you're calling a death sentence. What do you see happening now?
So we said this in response to repeated orders from Israel for the evacuation of the 22 hospitals in the northern part of Gaza. And it's very clear that many of the patients, there's more than 2,000 inpatients in those hospitals, are so sick. They are on life support systems, they have severe injuries, they are babies in incubators, who you simply can't move safely, and certainly not under these conditions. You'd only move them under very complex conditions anywhere in the world. And so you're putting the healthcare workers, giving them an impossible choice. Either they stay and they've been told to get out, that the hospitals will not be safe, so they know they won't be safe. They're putting their own lives at risk. But if they leave their patients will die. If they take their patients will die. So you've given them an impossible choice. And also hospitals, wherever they are, anywhere, must never be an attack. It must never be attacked. There must never be an attack on healthcare of any kind. It is a violation of humanitarian law.
Mm-hmm. And in terms of those people moving south, what are you hearing from your UN colleagues there, and the situation around the Rafah border crossing with Egypt, where we hear that hundreds of people are starting to mass? Are any essential medical equipment items getting through?
No, they're not. And we're standing by with a large contingent of supplies that we've flown in from our Dubai hub. And we've got that waiting just 20 kilometers from the border, ready to go in as soon as we can. We had our Director General, Dr. Tedros, spoke with the Egyptian president a few days ago and had certainly got agreement that we could go across from Egypt, but currently the border is not closed. I understand because it's not safe. And certainly with the huge influx of people in the south, we're hearing that the hospitals down there, who are again overwhelmed trying to treat the patients they have, all the many injured people, also have large numbers of people who've got nowhere else to go. So they're just sheltering in the environs of the hospitals. It really is catastrophic.
Mm. The US Secretary of State Antony Blinken is in Saudi Arabia, and he says that he wants to lift the siege of Gaza. What does the WHO make of the diplomatic efforts going on so far? Could they yield a sufficient delay to this presumed ground offensive to allow civilians to get out of harm's way?
So we have been calling for day one for an end to the hostilities, for both sides to stop, de-escalate, stop. But we have also been called for humanitarian access that makes it possible to bring the supplies in to help the doctors and nurses treat the many people. They don't even have pain medication in places, so you've got somebody in terrible pain who's had their limbs blown off and you can't even treat the pain. So yes, we hope and there's certainly a lot of work being done at all levels of the UN system to really beg that humanity, love of humanity, overcomes what is this terrible anger and hatred that's leading to terrible deaths and atrocities on all sides.
Mm-hmm. Absolutely. Dr. Margaret Harris, many thanks indeed for taking the time to speak with us today. We really appreciate it. Margaret Harris there from the WHO.